Hello dear students, myself Dr. Maddineni Srinivas. Welcome to Crack Derma with DrMSD. In this video, we are going to discuss the dermatology recall questions from INICET November 2025. Without any further ado, let us begin the discussion. The first question says, the match the following, you should match the sign with the disease, and this is a very easy type of questions. Whenever you have seen this in the exam, be happy, you are going to make it correct. But unfortunately, many students told me that in the real exam, the option which was matching the Auspitz sign with psoriasis was not there. So if at all that was the case, please comment yes sir in the comment section, and if that is the case, INICET has to give a bonus mark to everybody. So let us quickly see what were the answers for this flag sign. Where do you see? It is a pediatrics and also dermatology related question. So yes, it is option C, Kwashiorkor, in which flag sign can be seen in associated with the hair. Auspitz sign, yes, it is psoriasis. Carpet tack sign is associated with the connective tissue disorder, discoid, lupus, erythematosus. So option D. Darier sign is associated with cutaneous mastocytosis, which is also called as Urticaria pigmentosa. Option B. So in this we have the option C, A, D, B, that is this one. So in the real exam, if at all there was wrong options, then everyone has to get a bonus. There is no other option. Right, next question. This is an interesting syndromic approach which is not included in the men. So inguinal swelling, it is for example bubo. If you remember LGV, Shancrot, both of them are associated with the bubo. So inguinal swelling, bubo treatment is included for men. Urethritis, yes, urethritis, gonococcal, non-gonococcal urethritis, it is also included for the men. Genital discharge, so in fact genital discharge, it could be like urethral discharge. Maybe examiners thinking that from the ulcer there is some discharge which is coming out. So whatever it is, genital discharge, urethral discharge, you can consider both of them the same. And in the men, yes, we are going to have the kit associated with the syndromic approach in the men for the genital discharge also. Whereas lower abdominal pain is associated with pelvic inflammatory disease, and this is associated only in women. So answer is going to be option B. And also I will give you bonus tip in kit number 2, which is associated with vaginal discharge. That is green colored kit. Even this does not have anything to do with in the men. So yellow colored kit, kit number 6, and kit number 2, green colored kit, both of them are not included for men. I hope this is clear. This is a very much repeated question, very much important question as well. So green and yellow kits are not having any role in the men, right? Next question. Recurrent, a person is presenting with recurrent red circular patches on the thigh at the same site on 3 different occasions. So at the same site, it is a recurrent lesion which is developing in this patient, and maybe the next part of the question might not have been included in the actual question, that it is leaving behind hyperpigmentation. But still in the question with this part, you can think of a possibility of fixed drug eruption with this image, especially which is looking like a dusky red hue surrounded by proper erythema. This is a classical lesion of fixed drug eruption, but in the options it was mentioned as drug induced eruption is what many students have told. Okay. And some students may get, sir, why is it not herpes simplex viral infection? Because it is also recurrent. But remember students, in herpes infections we are going to see the recurrent vesicles developing, but here the picture is not showing any vesicles, so it is not D. I hope it is clear. And this is a favorite hot topic for the examiners. In fact, there were 2 questions in the same paper. Farmer coming with multiple sinuses, and what are coming out from the sinuses? Granules. Which color granules are coming out? Yes, it is black colored. So this is a very important question, and the important clues are given. The image is also there which is showing the swelling, and you are having granules and sinuses. So this triad of GST, if you remember, we have discussed this with the help of RGP Ram Gopal Verma. So GST, granule sinuses tumefaction or tumor or swelling. If they are present, you should think of the diagnosis of mycetoma. And mycetoma is again of two types, eumycetoma and actinomycetoma. If the black colored granules is mentioned, then it is eumycetoma, which you should think of. In actinomycetoma, we are going to have pale granules. Okay, so among the given options, it is option B, that is Madurella mycetomatis, which is associated with eumycetoma producing the black colored granules. Rest of the others, they are all going to produce actinomycetoma, so they are all going to have pale granules coming out through the sinuses. I hope everyone made this correct. Very, very important repeated question. You definitely have to make this correct. So this is some interesting question. It is mentioned as the virus is infecting keratinized squamous epithelium, and you need to identify the correct statement. And students told me that this was the picture which was given, and it was mentioned in the image that virus is infecting more in the stratum basal layer. And in dermatology, remember, the virus which loves to infect the basal layer is HPV, human papilloma viral infection. So you need to think of possibility of HPV associated warts. So with that knowledge, if we look at the questions options, you can see recurrent genital ulcer is a common presentation. So for the warts, if you remember, verrucous lesions are the common presentation but not genital ulceration, so that is wrong. No vaccine is available. No vaccine is available. Why? What is the reason for the vaccination which is produced with so much of research and development? The reason is because this HPV virus is oncogenic virus. It is associated with malignancy. To counter that malignancy, to prevent prophylactically, we have developed this vaccination. And yes, so B is the correct statement. And in fact, it is a DNA virus but not a RNA virus, HPV. So I hope this is clear. If you have any doubts or anything else was asked in the options, please put the concern in the comment section, your feedback in the comment section. Right, next, this is one more interesting question related to melanoma, that too specifically in the Indian population. The most common site overall in the malignancies, what will you think? Oh, sun exposed area, ultraviolet rays. But in the Indian or dark skin individuals, it was observed that it is the acral areas, that palms and the soles, which are going to be commonly associated with malignant melanoma. Very important memory point which you need to remember. Okay. Right, this is the next question, which is 65-year-old post-menopausal woman. So this is actually very important point, a post-menopausal woman presenting with intense itching and also soreness in the vulvar area. Vulvar area is having itching and soreness, and skin is atrophic white and it is parchment like. These are very, very important pointers which are given in the exam actually. And biopsy was done, which is showing epidermal thinning is present, and loss of rete ridges is present, which is again pointing towards the reducer thickness of the epidermis, right? And it is mentioned that hyalinized collagen is present in the upper dermis. This is a most important clue we can say in this question in the biopsy. So hyalinized collagen is present in the upper dermis. This is pointing towards one possible connective tissue disorder, which is actually a variant of morphia, which is lichen sclerosis. Okay, remember, lichen sclerosis is actually LSEA. The complete name is LSEA. EA stands for lichen sclerosus yet atrophicus. Okay, so this is also one more important clue in the clinical picture which the examiner actually gave you. And this very important concern in the postmenopausal woman who is having this itchy lesions associated with whitish discoloration, atrophic changes and histopathological changes. We need to monitor these women very closely because there is every possibility that this may go in and become malignancy later on. So monitoring of these patients is very, very crucial and very, very important. Okay, that's why This is actually a previous year question where image was given previously, but now image is not given, but the description was given in the question. I hope it is clear for all of you. Right, this is the next question. This is a one-liner type of question. So strawberry cervix, that was what mentioned, but rest of the question was not given in the actual exam, right? So what do you think of the answer? It is Trichomonas vaginalis. Very, very important concept which you need to remember. Trichomonas vaginalis associated with the strawberry cervix, trichomoniasis. Sure. Next is, this is also we can say a repetition of the previous question. Farmer usually have this minor trauma or prick injuries, thorn prick injuries, okay, right? So all of them except which is that odd man out in this condition, mycetoma. Yes, thorn prick can produce. This is a subcutaneous fungal infection. Even sporotrichosis, even chromoblastomycosis, all these are going to be called produced due to inoculation of the fungal elements through the prick, okay. That's why they are also called as implantation fungal infections, implantation mycosis. Whereas dermatophytosis, it is a superficial fungal infection. It is going to spread from one person to another through just the touch, through skin to skin contact, through even clothes, fomites also, right? So very important topic from fungal infection. This is repeated so many times. Even in this paper itself, there was a question on mycetoma also, if you remember, right? Chalo, next is this question which is a microbiology question, but still I am discussing because there can be skin lesions in these conditions. So larva currents, if you remember, Strongyloides turcoralis, okay. Cutaneous larva migrans, yes, it is Ankylostoma brasiliensis. Remember, important negative point, cutaneous larva migrans is not caused by Ankylostoma duodenale. That is the important negative point you need to remember. Visceral larva migrans, Toxocara canis, swimmer's itch, cystosoma. So these are we can say memory points. Answer is going to be A, B, C, D, option A, right? So these were the questions which I could get hands on related to dermatology, microbiology, pediatrics, some kind of integration. If you are having any doubts in these questions, please put the doubts in the comment section. If you are having any new questions related to dermatology, put them in the comment section. I hope this video was helpful. If so, please hit that like button and do subscribe to my channel for more such videos on a regular basis. Thank you so much. You can join all my dermatology related groups. The links are there in the description and also in the comment section. Thank you so much. Happy learning. Sarvam Sri Krishna Pranam Sarvajana Sukhana Bhavantu. All the very best. Take care.